We are going to discuss hypertension and the different types of hypertension and what do you do when you see a patient of any age, whether in the clinic or in the emergency room, who comes with high blood pressure. Uh, so hypertension means increased blood pressure. It's often, there is no definition of it, but often 135/85 is considered to be the high limit of normal, and anything above that is high. People who have diabetes, you tend to keep it below 135/85. But in the other groups, you can be a bit flexible. Above the ages of 65, you can be a bit more flexible because controlling the blood pressure can be really a task in that age group. Um, in order to understand what blood pressure really is, imagine that there is a water supply in your area, and that's got a tank, it's got water in it, and then we've got pipe, and then we have a tap. There is a pump over there which pushes the water outside. So the pump pushes the water, then you've got a pipe, and it's the diameter of the pipe which is important because it means how much water can actually flow out in a push, and then you've got the actual water. These three are required to have a water pressure. So the pump, the pipe, and the water. In the body, you've got these three structures which are required in order to maintain a blood pressure: the pump, the pipe, and the water. The pump is the heart, the pipe is the blood vessel, and the water is the blood. If you've got a pump which is weak, then you won't really get any blood pressure, just like as you see in cases of heart failure. Likewise, if you've got vessels which have been dilated either by means of medications or by some illness, for instance, somebody's got septicemia and the vessels they have dilated, the blood pressure is going to fall. And likewise, blood, if somebody loses lots of blood, somebody loses lots of water, they wouldn't have a blood pressure. So these three are required for a adequate blood pressure. Now, what happens is when it comes to hypertension, we first of all need to know the physiology of blood pressure. In order to know the physiology of blood pressure, we have to know what cardiac output is. And the cardiac output is defined as stroke volume multiplied by heart rate. And the stroke volume comprises of three different elements. One is called as the preload. The second one is called as the cardiac contractility, and the third one is called as the afterload. Cardiac contractility means that the strength of the myocardium when it pushes blood. Preload obviously is that how much blood is coming in, and afterload is how much resistance it has to face. While blood pressure is equal to cardiac output multiplied by peripheral vascular resistance. And the peripheral vascular resistance, as the name indicates, is the vascular resistance. The afterload also takes into account the aortic valve because the blood has to go through the aortic valve. And so therefore, that's obviously narrow because it's a door and it's a narrow door. So the afterload takes into account the aortic valve, while the peripheral vascular resistance entirely means the resistance in the peripheral blood vessels. So in order to have a normal blood pressure, you should need a decent cardiac output, and you need peripheral vascular resistance as well, which the tone of which it tends to alter. And this is where the blood pressure medicines also work. Now, if you see, heart rate is a very important component of blood pressure because ultimately it will define the blood pressure. Heart rate means that the faster the heart rate, the more likely that you will get a higher blood pressure reading. And the slower the heart rate, likely that you may get a lower blood pressure reading, as we see in cardiac arrhythmias. And the heart rate is the one which is the commonest problem when you see a younger patient. These days, we see men and women in their 20s and 30s, and they come with blood pressure. And with the availability of household blood pressure monitors, they're directly monitoring their blood pressures more and more. And they often come with a blood pressure in the range of 140/90. In my experience, this is a blood pressure which is not probably, I wouldn't label them as being hypertensive, but this is a blood pressure which is linked with the heart rate. So it's always important to ask them, what was your heart rate when the blood pressure was checked? If the heart rate was high, then you need to give a younger person a beta blocker. So the beta blockers are the most effective drugs in a younger person. Somebody comes in their 20s, somebody comes in their 30s, give them a beta blocker. Don't give them anything for these things. Because when you give a beta blocker, it will slow the heart rate down, plus you'll also relieve some of the symptoms of anxiety which they have, and this often helps with their blood pressure. And once again, it's not wise to label them as hypertensives, because then they'll actually be stuck with the diagnosis all through their lives. When it's a secondary hypertension, or when you've got somebody who's in an older age group, then often heart rate is not an issue, because these people come with heart rates which are normal, like between 65 to 70. So giving them a beta blocker will not make any difference. But these are the people who now require a vasodilator. And the two vasodilators which we use are the calcium channel blockers, the ACE inhibitors, or the ARP groups. And these are potent vasodilators. So you can use a vasodilator. So unless you use a vasodilator in an older person, somebody 50 plus, unless you use a vasodilator, you cannot bring the blood pressures down. The trouble with the vasodilators, them being potent antihypertensive drugs, they'll cause symptoms like fatigue and weakness and tiredness, along with symptoms of fluid retention in the form of ankle edema, and then simultaneously with tachycardia. So often with these medications, the calcium channel blockers and the ACE inhibitors and ARBs, you have to give a beta blocker, and simultaneously often have to give a diuretic. And this should cover the bulk of the patients who attend your clinic or the emergency department. So once again, just to summarize, young person coming in, don't label them as hypertensive, give them a beta blocker for a short period of time, not for a long period of time, and then ask if they can modify their lifestyle, whatever they're doing. Often it comes and goes. But in somebody who's middle-aged and above, beta blockers won't help. Give them an ACE inhibitor, an ARB, or a calcium channel blocker. And often they also require a beta blocker along with it. Thank you.